start discussing these MCQs one by one. So this is the first MCQ for today. I will read it for you and then I will raise a poll. Try to participate in the poll. An ischemia forearm exercise test with a rubber ball is performed on a 22-year-old male patient who has a congenital deficit of muscle phosphorylase. So they are not expecting you to make a diagnosis of the enzyme defect. What they have done is they have given you which enzyme is defective. They're asking you what will be the biochemical changes that are observed here. So when compared to a typical person doing the same test, what would this patient display? High blood glucose in the blood drawn from the exercising forearm, exercise endurance, high blood lactate in the blood drawn from the exercising forearm, relatively low blood lactate in the blood drawn from the exercising forearm vein. So try to answer this question, all of you. Even if you know nothing, please participate in the poll. Okay. I will then explain everything in detail. Very good, Abhi. Good, Dikshita, Pratishta, Uma, Chandra, Joy. Yeah, as expected, many of you have chosen choice C, increase in blood lactate in the blood drawn from the exercising forearm vein. Good, Joy. Janisha, very good. Yashmin, good. So what is the answer, all of you? The answer is there will be low lactate in the blood drawn from the exercising forearm. Can you tell me why? They've given you the enzyme which is defective is muscle phosphorylase, right? When muscle phosphorylase is defective, will the muscle be able to get glucose? Only from glycogen phosphorylase action, all of you listen to this, only by the action of glycogen phosphorylase in the muscle will get glucose. Without glucose, can there be lactate formation, all of you? Without glucose, can there be lactate formation? No. So what will you observe here in McArdle's? There is low blood lactate level in the blood drawn from the exercising forearm. So let's try to discuss about this in detail. Let me tell you about McArdle's. Tell me what is McArdle's, all of you. Do you all know that McArdle's disease is type 5 glycogen storage disorder? Tell me yes or no. I want all of you to be active in the chat box, please. Yeah. McArdle's is type 5 glycogen storage disorder, wherein the enzyme which is defective is muscle phosphorylase. And this condition presents as an intolerance to anaerobic exercise. McArdle's, what will be the presentation, all of you? The presentation McArdle's will be intolerance to anaerobic exercises. Can you tell me why anaerobic exercises? What if you ask the person to perform aerobic exercises? If you ask the person to perform, very good, Pratishna. If you ask the person to perform aerobic exercise, what will be the preferred fuel, all of you? For aerobic exercise, the preferred fuel will be fatty acid. In McArdle's, is there any defect of fatty acid oxidation? There is no defect of fatty acid oxidation. So until you ask a patient of McArdle's to perform aerobic exercise, the person will be able to do it normally. Only when you ask the person to perform anaerobic exercise, the person will complain of painful muscle cramps. Okay, now tell me what is an anaerobic exercise? What is aerobic and what is anaerobic exercise? Asking the person to do something against resistance. Yeah, asking the person to do something against resistance. In that case, what will happen to the length of the muscle fiber? Suppose I'm showing you a wall and I'm asking you to do push-ups. Yeah, so in that case, what is happening to the length of the muscle fiber? The length of the muscle fiber is kept as a constant. Yeah, when the length is constant between two fixed points, when the muscle contracts, what will happen to the tone, all of you? When the length is constant between two fixed points, when the muscle contracts, what will happen to the tone? The tone increases enormously. When the tone increases, what will happen to the blood vessels which are getting into those muscle fibers? Blood vessels getting into those muscle fibers will get constricted. When blood vessels get constricted, will the muscle fiber be able to get oxygen? When the blood vessels get constricted, will the muscle be able to get oxygen from the circulation? There is no access to oxygen. And that is why we call it as anaerobic exercise. Do you all understand this? So what do you mean by anaerobic exercises, all of you? Anaerobic exercises are nothing but isometric exercises. Is that clear? Anaerobic exercise, nothing but isometric exercises. When it is isometric exercises, all blood vessels get constricted. So the muscle will not be able to get oxygen. That is why we call it as anaerobic exercise. Okay. Now, in this case, if glycogen phosphorylase is defective, yeah. So first tell me, if it's anaerobic exercise, what will be the preferred fuel? If it's aerobic exercise, fatty acid becomes the preferred fuel. If it's anaerobic exercise, what is the preferred fuel? It is glucose. And from where will the muscle get its glucose? Can the muscle get its glucose from circulation, all of you? Can the muscle get glucose from the circulation? For the same reason why I told you the muscle is not able to get oxygen, the muscle will not be able to get glucose as well, because the blood vessels are constricted. So no other go, the muscle becomes dependent on its glycogen. Okay. And in this case, there is glycogen phosphorylase defect. If glycogen phosphorylase is defective, will the muscle get glucose from its glycogen? No. So there is no way the muscle is able to get glycogen. Glycogenolysis does not give glucose. Blood is also not going to give glucose. So without both the forms of glucose, there is no glycolysis. When there is no glycolysis, tell me what will happen to ATP. When there is no glycolysis, tell me what will happen to ATP. No ATP production. And this lack of ATP is the reason for painful muscle cramps. Can you tell me why lack of ATP should cause muscle cramp? Because not only for contraction, even to bring about relaxation, you need ATP. Do you all know that? Yeah, not only to bring about contraction, even to bring about relaxation, you need ATP. Because for your muscle to relax, what you're supposed to do is you're supposed to take back calcium into sarcoplasmic reticulum. Yes or no? For contraction, you release calcium from sarcoplasmic reticulum. For relaxation, what are you supposed to do? For relaxation, you should take back calcium. How do you take back calcium, all of you? You take back calcium by calcium ATPase. And this calcium ATPase needs ATP. So when there is ATP depletion, which pump fails, all of you? When there is ATP depletion, calcium ATPase fails. So sarcoplasmic reticulum will not be able to take back calcium. So calcium stays back in sarcoplasm. That causes sustained contraction. And this sustained contraction is the reason for muscle cramp. Is that all? Is that clear to all of you? Yeah, so I always say this, do not have this relationship that you have between cramps and lactic acid in your mind. Yeah, please cut off the relationship that you have between muscle cramp and lactic acid in your mind. Yeah, so it's always taught in your school that lactic acid is the reason for muscle cramp. But what is the carry home message for today? The carry home message for today is lactic acid is not the reason for what is your sodium potassium also fails. Sodium potassium failure does not cause muscle cramp here, Deekshita. Yeah, here the reason is because calcium is not being pumped back. Yes, sodium potassium ATPase pump can also fail. Okay, so it is not because of lactic acid accumulation. What is it because of? It is because of ATP depletion. Okay, and there is also another mechanism that you should remember as far as McArdle's disease is concerned. Yeah, and that is second wind phenomenon. But if lactic acid accumulation production means less ATP production, so muscle cramp. Surgeon, can you please listen to this sequence that I told you? In this case, I'm not discussing anything about normal person. In McArdle's, there is no muscle phosphorylase. Are you clear about this? There is no muscle phosphorylase. Without muscle phosphorylase, there is no glucose. Without glucose, there is no glycolysis. Without glycolysis, can there be lactate formation? Can you answer this? Without glycolysis, can there be lactate formation? No lactate formation. So actually in McArdle's, lactate level in the arm will be less. Do you all understand this? In McArdle's, lactate level in the arm will be less because there is no glycolysis. Can you see that here? This is what I want you to all understand. There is low lactate level in McArdle's in the working arm. Okay. And what is the other phenomenon that you should all remember? The other phenomenon is second wind phenomenon. So what is second wind phenomenon? Have you heard of this? This has been asked so many times. In normal person also, lactic acid is not the reason. Even in you and me, yeah, even in supposedly normal people, if you get cramp, it is because of ATP depletion or it is because of hypocalcemia. Yeah, whenever there is hypocalcemia, you know, nerves become hyperactive. Yeah, the resting membrane potential becomes, it gets close to threshold potential. So all muscles and nerves are hyperactive. That causes cramp. So hypocalcemia can cause cramp. ATP depletion can cause cramp. It is not lactic acid which causes cramp. Around the time when you experience cramp, in a normal person, when a person experiences cramps, if you get a blood sample and if you estimate lactate level, it happens to be high. It is just an association. It is not a cause. Is that clear? Yeah, it is just an association. It is not the cause. And even an association is not observed in McArdles. Okay. So what is second wind phenomenon? Second wind phenomenon is when you ask the person to perform anaerobic exercise, after 5 to 10 minutes of starting exercising, they will complain of painful muscle cramp. Yeah, they will complain of painful muscle cramp. Even after that, if you ask the person to continue exercising, there will be a second wind wherein the person says, yes, I'm getting relieved of my pain. Now I'm able to exercise. That is called the second wind phenomenon. That happens even to you and me. Yeah, we always say if you are doing a marathon, a full marathon or a half marathon, around 10 kilometers, you feel cramps. Yeah, if you overcome that, yeah, after that, there will be no cramps. You'll be able to work continuously. So that's called the second wind phenomenon. Yes, Dimple is right. So the reason for second wind phenomenon is something called as metabolic switch. And what is metabolic switch? It is nothing but the person starts switching from anaerobic metabolism to aerobic metabolism. So how will you be able to switch from anaerobic? Very good, surgeon. Both answers are right. So how will you be able to switch from anaerobic metabolism to aerobic metabolism? By two mechanisms. One is there will be vasodilatation. Yeah, there will be quick vasodilatation. When there is vasodilatation, what will the muscle do? The muscle will quickly get oxygen from the circulation. The muscle will quickly get glucose from the circulation. With both glucose and oxygen, it will be able to generate ATP. And with ATP, what will happen? The cramp will be relieved of. Okay. So there is quick vasodilatation. That is one reason. And the other reason is myoglobin in the muscle. Yeah. So long I was telling you, whenever you do anaerobic exercise, it is just that the muscle is not able to get blood oxygen. Didn't I tell you that? The muscle is not able to get blood oxygen, but the muscle has got myoglobin, right? So that myoglobin can provide oxygen. Okay, so these are the two reasons for how it switches over from anaerobic metabolism to aerobic metabolism. How to bring vasodilatation? Vasodilatation, it is, have you heard of autoregulatory mechanism in cardiovascular system? Yeah, autoregulatory mechanism. So whenever there is an increase in the rate of metabolism in a tissue, because of local autoregulation, there will be vasodilatation. That's a normal phenomenon that happens. That's why I told you, second wind is not only for, yeah, your marathon means we also, yes, we also have second wind. Second wind is not an abnormal phenomenon that is happening only in McArdle's, all of you. Second wind can happen in you and me if you do a long marathon, or even when you try to do an anaerobic exercise. Initially, you will feel cramps, and then if you overcome it, yeah, if you overcome it, then you will be able to continue it. Second wind is something normal because we also switch over from anaerobic metabolism to aerobic metabolism, because we can also cause vasodilatation. We also have myoglobin. So the same thing happens in McArdle's. That is second wind phenomenon. Do you all understand that? Yeah, so what are the facts that you have learned about McArdle's? Can you summarize about McArdle's, all of you? I will be happy if you can all actively participate in the discussion. Okay, so what did I tell you about McArdle's? McArdle's is type 5 glycogen storage disorder. What is the enzyme that is defective here? The enzyme is muscle glycogen phosphorylase. And if you suspect muscle glycogen phosphorylase defect, how will you detect it? By asking the person to perform anaerobic exercise. So what will the person present with? The person will present with intolerance to anaerobic exercises, wherein the person complains of painful muscle cramps after 5 to 10 minutes of initiating anaerobic exercises. And what is the reason for painful muscle cramp, all of you? The reason for painful muscle cramp is ATP depletion. Why is there ATP depletion? Because glycogen phosphorylase is defective. The muscle is neither able to get glycogen. The muscle is neither able to get glucose from its glycogen, nor can it get glucose from the circulation. So no glycolysis, no ATP production. Yes, no glycolysis, no ATP production. So around the time when the person complains of painful muscle cramp, if you get a blood sample and if you estimate lactate level, the lactate level in the circulation will be less. Yeah, decreased lactate level. Okay. And they're also characterized by second wind phenomenon. What is second wind phenomenon? It's metabolic switch, wherein the person switches over from anaerobic exercise to aerobic exercise. And that is made possible by local vasodilatation as well as by using myoglobin of the muscle. Okay, so what is answer, all of you? In McArdle's disease, will there be increase in blood glucose in the blood drawn from the exercising forearm vein? No. Will there be increase in blood lactate level? No glycolysis. Will there be relatively low blood lactate level? This is true. Okay. So this is the first question. Let's discuss the second one. So this is an interesting question. I wanted to treatment giving vasodilatation drugs. It is not that serious to be giving vasodilatation drug, Deekshita. McArdle's, they complain of muscle cramp only for some time and then they will be able to overcome it. I told you, right? Second wind phenomenon. Okay, it happens automatically. Okay, so I've given you. Yes, second wind phenomenon can happen in isometric exercise, isotonic exercise, whatever it is. That's why I told you myoglobin is also used. Okay. So this I included primarily because I wanted you all to understand how to differentiate the various glycosphingolipidosis. Yeah, because this has been, I know for many of you, this is quite a nightmare, right? To find out whether it is GM1 gangliosidosis, GM2 gangliosidosis, Gaucher's and everything. Yeah. So let's try to find out how to do it. So let me read the question for you. For the first few months, an 8-month-old child's growth and development were normal. Then symptoms such as deafness, blindness, atrophied muscle, inability to swallow, and convulsions began to appear. Who's confused? If there is any confusion, please type. I will be happy to explain it. Okay. During the fundus inspection, a cherry red macula was also seen in both the eyes. So neurological manifestations predominantly accompanied by cherry red macula. Okay. Suspecting sphingolipidosis, the physician tested for globocytes and gangliocyte levels and found that both were increased. Based on this finding, what is the most accurate diagnosis for this patient? So Deekshita says it is Tay-Sachs. I will raise a poll for you all. Please participate in the poll. Let me see how many of you have already understood it. Good, Ayush, Tiko, Abhi, Kartika, Chetan, Lakshmi, Pratishta, Shivam. Yeah, Shivam is the main reason for this question. Surgeon, Chandra, Archie. Okay, good. So 22% of you have answered it right. Many of you have chosen it as Tay-Sachs. Okay. Some of you have even chosen it as Gaucher's, and I think one of you have chosen it as Fabry's. Okay. So to summarize this, as I told you, it's neurological manifestations accompanied by cherry red macula, accumulation of globocytes and gangliocytes. So these are the positive findings. Just because there is cherry red spot, yeah, I'm going to straight away exclude two choices here. One is Fabry's, the other one is Gaucher's. All of you listen to this. Fabry's and Gaucher's do not present with cherry red spots. So tell me, what are the conditions which do not present with cherry red spots? Cherry red spots are not a feature of Gaucher's, not a feature of Fabry's, not a feature of crabs. Do you all understand this? No cherry red spots seen in gauchers, fabries, and crabs. Okay. And there is another reason, yes, seen in Tay-Sachs and Sandhoff. Okay. So another reason for why I've excluded gauchers and fabries. Because in gauchers, there is accumulation of cerebrocytes. Can anybody tell me which enzyme defect causes gauchers, all of you? Gaucher's disease is caused by a defect of beta glucosidase. Yeah, Gaucher's disease caused by a defect of beta glucosidase, in which case glucosyl ceramide accumulates. Glucosyl ceramide is called the cerebrocyte. So tell me, what is the lipid which accumulates in Gaucher's? All of you please memorize it. In Gaucher's, it is cerebrocytes. Whereas in Fabry's disease, it is globocyte. In Fabry's disease, it is globocyte. But what does the question say? Read the question and tell me. The question says there is accumulation of not only globocyte, there is also gangliocyte accumulation. Okay, so based on this, can we exclude choice C and D? All of you? Yeah, so tell me, what are the two reasons for why I've excluded choice C and choice D? Cherry red spots are not a feature of Cherry red spot is not a feature of gauchers, fabries, and crabs. Okay. And in gauchers disease, it is cerebrocyte accumulation. In fabries, it is globocyte accumulation. Now about Sandhoff and Tay-Sachs. Do you know that both are caused by a defect of hexosaminidase? Do you know that? If you don't know, please memorize it. Sandhoff is caused by a defect of hexosaminidase B gene. Yeah, Sandhoff is caused by a defect of hexosaminidase B gene, whereas Tay-Sachs is caused by a defect of hexosaminidase A gene. Okay, so let's try to learn few facts about hexosaminidase. Okay, so hexosaminidase is a dimer. Hexosaminidase enzyme is a dimer. It can be made up of two subunits, which can be formed with either alpha or beta subunits. So hexosaminidase is formed by various permutations and combinations of alpha and beta subunits. In the sense, it can be made up of alpha alpha or alpha beta or beta beta. Do you all understand this? Hexosaminidase can be made up of 2 alpha or alpha beta or beta beta. Okay. And hexosaminidase alpha subunit is coded by hexosaminidase A gene. All of you please listen to this. Not understanding this, you cannot just memorize everything and reproduce. Yeah, if you just memorize anything, then it will be there in your memory probably for few days. Yeah, after that, when you try applying it, you won't be able to apply it. Okay, so listen to this carefully for another 5 minutes, then you will understand why we say few facts. Okay, so alpha subunit is coded by hexosaminidase A gene, beta subunit is coded by hexosaminidase B gene. Okay, and what about hexosaminidase A enzyme? I'm telling you now about enzyme. Enzyme and genes are different. Hexosaminidase A enzyme has got alpha beta subunits. Do you all understand this? Hexosaminidase A enzyme has got alpha beta subunits, whereas hexosaminidase B enzyme has got beta beta subunits. Okay, and what did I tell you about Tay-Sachs? Tay-Sachs is caused by a defect of what? Can you all answer? Tay-Sachs is caused by a defect of hexosaminidase A gene. Yeah, it is caused by a defect of hexosaminidase A gene. And Sandhoff is caused by a defect of hexosaminidase B gene. Now tell me, in Tay-Sachs, when hexosaminidase A gene is defective, alpha subunit is going to be defective. When alpha subunit is defective, which enzyme will be defective? When alpha subunit is defective, which enzyme will be defective? Hexosaminidase A enzyme alone will be defective in Tay-Sachs. Do you all understand this? So in Tay-Sachs, hexosaminidase A enzyme alone is defective. Whereas in Sandhoff, it is caused by a defect of hexosaminidase B gene, which codes for beta subunit. And if beta subunit is defective, what are the two enzymes that will be defective? Both hexosaminidase A enzyme and hexosaminidase B enzyme will be defective. Are you clear about this? Yeah, are you clear about all the factors that I've told you so far? Yeah, so tell me the differences between Tay-Sachs and Sandhoff. Can you all summarize Tay-Sachs and Sandhoff? Because there are many ways that the question can be asked. Okay, So if they ask you gene defect, what will be your answer? Tay-Sachs is caused by a defect of hexosaminidase A gene. Sandhoff is caused by a defect of hexosaminidase B gene. And if they ask you enzyme defect, if they ask you enzyme defect, in Tay-Sachs only hexosaminidase A enzyme is defective, whereas in Sandhoff both hexosaminidase A enzyme and hexosaminidase B enzymes are defective. Are you clear so far? Yeah. And hexosaminidase A, it is related to metabolizing only GM2 ganglioside. Yeah, hexosaminidase A enzyme is involved in the metabolism of only GM2 ganglioside. So tell me what is expected in Tay-Sachs, all of you. What is expected in Tay-Sachs? Wherein hexosaminidase A enzyme alone is defective, that will be accumulation of only GM2 ganglioside. Okay. Hexosaminidase B enzyme. Hexosaminidase B enzyme is not related to GM2 ganglioside metabolism. It is related to metabolizing a globoside. Hexosaminidase B enzyme is related to metabolizing a globoside. Even in this globoside, do you see a galactosamine here? Even in this globoside, do you see a galactosamine? To metabolize this galactosamine, you need hexosaminidase. Okay, so tell me about Sandhoff. In Sandhoff, what will accumulate? In Sandhoff, there is a defect of both hexosaminidase A enzyme and B enzyme. So there will be accumulation of both ganglioside and globoside. Do you all understand this? There will be accumulation of both ganglioside and globoside. So what is the carry home message here? The carry home message here is, if you're joining my session for the first time, if you're confused, please type it in the chat box. I will be more than happy to repeat it. If you give a confusion emoticon, I won't be able to help you. So I always say this in all my sessions. The advantage of you attending a live online session is that you should get your doubts clarified real time. Okay, so whenever you have a doubt, please stop me, ask me a doubt. I will be happy to explain. Okay, so that is about Tay-Sachs and Sandhoff. So tell me, in Tay-Sachs, which lipid accumulates, all of you? In Tay-Sachs, there is accumulation of only GM2 ganglioside, right? In Sandhoff, there is accumulation of both GM2 ganglioside and globoside. In Sandhoff, there is accumulation of both GM2 ganglioside and globoside. So can we summarize the differences between Tay-Sachs and Sandhoff, all of you? Tay-Sachs and Sandhoff. First, tell me which gene is defective in Tay-Sachs.